Why are you still here? Let's go, first aid class.
Hello again. We meet again on a new chapter. Today, I'll be introducing you to a new chapter which is on wounds and bleeding. My name is Dr. Tan from St. John Ambulance of Malaysia, State of Penang. Let us recap what we have learned on the last episode. Last episode, we learned about poisoning, bites and stings. What is bites and sting and poisoning to do with wound and bleeding? Bites and stings sometimes may involve puncture of wound, such as bites from animals or insects, etc., causing wounds and bleeding. So today we will learn more in detail about wounds and bleeding. First, let us start off with our circulatory system. Our circulatory system consists of our heart, which is our main pumping organ, and a huge network of vessels. Vessels include arteries, veins, and capillaries. When our heart is pumping, it will pump oxygenated blood and nutrient via the arteries to reach the vital organs. At the vital organs, it will go through a series of capillaries where exchange of oxygen and nutrient take place at the vital organs. After that, the vital organs will transfer deoxygenated blood and blood that contains less nutrient back to the heart via the veins. When the heart is pumping, there is a flow of blood via the arteries and vessels, which can be recorded from our blood pressure monitoring. Now, let us discuss in more detail about blood and its composition. Our normal human, adult-sized human, will have 6 liters roughly of blood. 6 liters of blood, 55% will be yellowish fluid, which is plasma, whereas another 45% will consist of red blood cell or called hemoglobin, white blood cell and platelet. Red blood cells is involved in carrying oxygen in the blood, whereas white blood cells are involved in our body defense mechanism fighting against infection. Platelets, on the other hand, plays important role in blood clotting. When there's a wound, platelet will play its function to help blood clotting. There are 3 different vessels in our body, mainly the arteries, the veins, and the capillaries. Arteries carry oxygenated blood and nutrient from the heart to reach the vital organs, whereas veins carry deoxygenated blood from the vital organs back to the heart. While vessels, such as capillaries, they are small interlinking vessels that connects between arteries and veins. That is where the exchange of oxygen and gases and nutrients take place. Bleeding occurs when there is a puncture in the vessels. Depending on the types of vessels which is punctured, bleeding is differentiated based on the different types. There are basically 3 types of bleeding, which are bleeding from the arteries, bleeding from the veins, and bleeding from the capillary. How do we differentiate them? First thing, if it is a bleeding from the artery contains oxygenated blood, hence it is bright red in color, and it is connected directly from the heart. Hence, when the heart pumps, you will see blood coming out, spurting out from the wound.
Let's remove the gauze and see how bad this cut is. And this gentleman, it does have a squirter there.
If it is from a vein carries deoxygenated blood. Hence, the color of the blood is darker in color, less bright red compared to artery. Blood normally from the vein will ooze out from a wound and it will pool around the area. Whereas if you have a cut on the skin tissue or any place, if there is a bleeding from the capillary, since capillary interconnects artery and veins, the color is a mixture between bright red and darker red, and normally bleeding from the capillary are very minimal and it will stop briskly. If you see somebody sustain a cut over the arm, how do we know what sort of bleeding it is from? I would say you can differentiate them based on the location. First thing, look at the blood. If you see the blood coming out from a deep wound and it is bright red in color and is spurting out according to the pumping of the blood, then that is an artery. So that is actually an important and major wound or bleeding. If you see a cut where the blood comes out darker red in color and it oozes out, that most likely is from a vein. But if a person had just a small cut on the skin or tissue where blood, or should I say minimal blood, comes out from the tissue, that mainly is from the capillary. Shock has been mentioned many times in our previous topics. During management of different types of condition, we were advised to treat and prevent for shock. Now let us discuss in further details about what is actually shock. Shock is a life-threatening condition that happens because of failure of our circulatory system. Our circulatory systems consist of heart as the major pumping organ, which will pump blood that contains oxygen and nutrient to the vital organs. When there is a failure in this circulatory system, shock occurs. Shock is actually a life-threatening condition that needs urgent medical treatment. It can be made worse by fear and pain. Hence, the main aim of treatment for first aid for shock is to reassure the patient and always provide comfort for the patient. The main reason of shock is because of hypovolemia, which is the main cause of shock. Hypovolemia can be due to insufficient blood supply because a person is involved in an accident and losing a massive amount of blood. When the blood is insufficient, it will have reduced supply reaching the vital organs. Hypovolemia or hypovolemic shock may also occur in other conditions where a person loses a lot of bodily fluid. For example, in a case where a person is dehydrated, where he loses a lot of body sweat, a person who may be having food poisoning, where he vomits and having diarrhea a lot of times, this may cause hypovolemic shock. Other causes of shock include cardiogenic shock. Cardiogenic shock occurs where the heart fails to pump properly. When the heart fails to pump properly, again there will be insufficient blood supply reaching the vital organs. Hence, the vital organs will have devoid of oxygen and nutrient as well. How does cardiogenic shock occurs? Cardiogenic shock, as mentioned, is because of problem or abnormality to the heart. For example, when a person has heart failure or when a person has a heart attack, this may cause the heart fail to pump, hence causing cardiogenic shock. Other reasons of shock include anaphylactic shock, where a person develops anaphylaxis or allergic reaction, hence reducing blood supply reaching the vital organs. The next type of shock is septic shock. Septic shock occurs when a person has severe infection And another type of shock is called the neurogenic shock, which occurs in a person with stroke or a person having spinal cord abnormality. To sum it up, there are different types of shock, mainly hypovolemic shock, which is due to loss of blood or loss of body fluid, cardiogenic shock, which is because of abnormality of the heart, which is the pumping organ, such as heart failure, heart attack, and other types of shock. For example, anaphylactic shock, septic shock, and neurogenic shock. Now, let us discuss about hypovolemic shock. Hypovolemic shock is one of the main causes of shock. It happens when a person loses excessively a lot of blood or body fluid. In our normal adult human, we have about 6 liters of blood. But when a person loses about 1.2 liter or about 2 pints of blood, shock and symptoms of shock will start to develop. Hypovolemic shock occurs in conditions such as when a person has bleeding. Bleeding can occur either externally, which can be seen, or internally via internal bleeding, where there is bleeding into our organs and orifices. Another common cause of hypovolemic shock, not due to blood, but due to losing a lot of fluid, in conditions such as severe burns, vomiting, diarrhea, dehydration. All those causes our body to lose fluid excessively, and it may also cause a person to develop hypovolemic shock.
Signs and symptoms of hypovolemic shock. Initially, the casualty may present with a rapid pulse when you feel over the wrist area. He may have pale, cold and clammy skin, and he may also be sweating profusely. If no treatment or management has been done, the shock may develop further. And when shock develops, the victim may present with more rapid shallow breathing. When you feel the pulse at the wrist, it may disappear. Having a weak and thready pulse. By this time, about half of the blood volume will have been lost. The victim may have cyanosis, which is grey-blue skin, especially inside the lips. His fingernail or earlobe, if pressed, will not regain its color immediately as well. He may also be having weakness and dizziness, nausea and possibly vomiting. He will also complain of thirst and will be drinking a lot of water. As the brain oxygen supply weakens and worsens further, there will be deteriorating in the level of consciousness, where he will become restless and aggressive in his behavior. He may be yawning and gasping for air. He may also become unresponsive, and finally, cardiac arrest may occur. The management of hypovolemic shock include 1. To recognize and treat any obvious cause of shock. This is done by treating any possible cause that you can detect, such as severe bleeding or serious burns. And of course, always reassure the casualty. Secondly, to improve the blood supply to the brain, heart and lungs by helping the casualty to lie down on a rug or blanket if there is one, as this will protect him from cold. Raise and support his leg above the level of his heart to improve blood supply to the vital organs. Loosen tight clothing to reduce constriction at the neck, chest and waist area. Keep the casualty warm by covering his body and legs with blanket. Thirdly, To arrange for urgent removal to the hospital, call 999 for emergency help. Tell the ambulance control that you suspect the victim is having shock. Along the way, monitor and record vital signs while waiting for help to arrive. Do not allow the casualty to eat or drink because an anesthetic may be needed. If he complains of thirst, moisten his lips with little water. Do not leave the casualty unattended unless you have to call emergency help. Do not warm the casualty with hot water bottle or any other direct source of heat. If the casualty is in the later stages of pregnancy, help her to lie down leaning towards her left side of the body to prevent the pregnant uterus restricting blood flow back to the heart.
In our previous topic, we did mention about anaphylactic shock causing airway obstruction. We shall now proceed with further discussion about anaphylactic shock. Before that, I would like to introduce to you about our body immune system. Our body immune system is actually our body natural defense mechanism protecting our body against external pathogens such as viruses, bacteria, and it protects us against diseases, illnesses, etc. What happens during an allergic response? It happens when our immune system may become abnormal for certain reason. Instead of protecting against external diseases, pathogens like viruses or bacteria, our immune system becomes abnormal and reacted against normal triggers such as dust, seafood, pollen, and others. When a person is allergic to this will cause allergic reaction. All these conditions, dust, seafood, pollen, for example, it may cause the immune system to react in an abnormal way. How abnormal it is. So a person, when they develop reaction or allergic reaction towards this, they or he will present with symptoms and signs such as watery eyes, running nose, he may feeling nauseous, feeling like want to vomit, for example. This is an allergic reaction. But what happens in anaphylactic reaction? It becomes more severe, more serious. More serious to the extent that it involves other systems, such as it may involve the respiratory system, where it causes obstruction of the airway. Why it causes airway obstruction? It is because our air pipe that supply air becomes swollen. When it becomes swollen, there will be reduced oxygen, reduced air, hence we cannot breathe. That's one. And when it's obstructed, sometimes we will hear abnormal sound when we breathe. We call this as wheezing. A person, although who may not be asthmatic, may also have abnormal sound like wheezing if he has anaphylactic reaction. It may also involve other systems, where it may involve the gastrointestinal system, where the person will feel like want to vomit. It may also involve the skin, where the skin may present with abnormal rashes, which we call as urticaria. So all this, and the more severe one will be, it may affect the heart. When it affects the heart, there may be having failure of the heart to pump properly. And when the heart has failure to pump, it may cause a person to feel dizzy. It may cause a person blood pressure to be low. So all this comes together as we call as a person as having anaphylactic shock. How do we know a person may have anaphylactic shock? The patient, apart from presents with those symptoms, sometimes the patient will also have very puffy face. When he has puffy face, we also assume that the internal structure in the face may be swollen and he may have difficulty in breathing. That is anaphylactic reaction.
Sign and symptom of anaphylactic shock. Features of allergy which may be present, such as red itchy rash or raised areas of skin, which we call as wheals, red itchy watery eyes, swelling of hands, feet and or face, abdominal pain, vomiting and diarrhea. There may also be difficulty in breathing, which may be ranging from tight chest to severe difficulty causing a casualty to wheeze and gasp for air. Pale or flushed skin. Visible swelling of tongue and throat with puffiness around the eyes. Confusion and agitation, and also signs of shock leading to collapse and unresponsiveness. The aim and management of the case will include immediately call 999, tell the ambulance control that you suspect anaphylaxis. To ease breathing, help the casualty to use the auto-injector of adrenaline if available. Help the casualty to sit down at the position that he feels comfortable. Treat for shock if the casualty becomes pale with a weak pulse. Help him to lie down with legs raised and treat for shock. Monitor and record vital signs such as breathing, pulse, and level of response.
We mentioned that hypovolemic shock may be due to bleeding. Bleeding can generally be divided into a few categories. We have external bleeding, we have internal bleeding. And both these can further be divided whether it is a severe bleed or a minor bleed. We should now concentrate on internal bleeding. Internal bleeding, as the term mentioned, refers to anything bleeding from the internal. Internal normally refers to our internal organs or orifices, such as from the nose, from the mouth, from the ears, or even from our anal region or our urethral region. These are orifices where, if there is bleeding from the inside, allowing blood to come out via the different orifices. Let me give you an example. Bleeding from the brain. This is also an internal bleed. When bleeding from the brain occurs, the orifices such as the eyes, the nose, or the ears, bleeding may come out from there. When there is bleeding from the brain, it may exert pressure over the brain and the component of the brain and causing a lot of complications. Internal bleeding occurs because of possible blunt injury that happens. For example, a person may have a blunt trauma over the abdomen area, causing the tummy or abdomen bleeding internally. And how do we know whether there is internal bleeding from the stomach or the abdomen area? It can be seen if a person vomits out blood or if a person passes out motion which is containing blood or red in color.
A casualty presenting with internal bleeding may present with the following sign and symptom. Firstly, he may be complaining of pain over the site with suspected internal bleeding. Information from casualty about recent injury or illness or operation may give a clue about the site of internal bleeding. There may be bleeding from body opening or orifices. In cases of violent injury, there may be pattern bruising, which is an area of discolored skin with a shape that matches the pattern of clothes or crushing of restraining object. The casualty will also present with symptoms and signs of hypovolemic shock. Initially, he may have pale, cold and clammy skin. If the bleeding continues, the skin may become cyanosed. He may be presenting with a weak and rapid pulse. The victim may complain of thirst. He also will present with rapid shallow breathing. As it worsens, there may be confusion, restlessness and irritability. He may also become unresponsive.
External bleeding can be divided into minor or severe bleeding. We will concentrate on minor bleeding first. Examples of minor bleeding include cuts and grazes. Normally, cuts and grazes are very minor condition where there is very limited blood coming out from tissues, which may be because of a small cut or abrasion. It can be easily controlled by applying direct pressure and elevation of the affected part. However, bear in mind that minor cuts and grazes have also higher risk of having infection. How do we know when a person may have a possible infection? If you notice the wound is dirty, if you notice there is a foreign body in the wound embedded there, or sometimes it may include a puncture wound due to a dirty object. Those are examples where a wound can easily be infected. When you're treating a patient or a casualty with grazes and cuts, do check about his immunization history. Ask about whether he has history of getting a recent tetanus injection before. If he has no recall of any tetanus injection, make sure he is referred to a medical personnel for immunization like anti-tetanus. When an external bleeding involves massive bleeding, especially involving cut or injury or bleeding from the vessels such as artery and vein, then this is called a major bleeding. Major bleeding most of the time involve hypovolemic shock. And one of the main important treatment for major bleeding, apart from trying to stop the bleeding, will also involve treatment of hypovolemic shock.
Management of severe bleeding. The most important, firstly, is to control bleeding. Apply direct pressure over the wound with your fingers using a sterile dressing or clean non-fluffy pad. If you do not have a dressing, ask the casualty to apply direct pressure himself. If there is an object in the wound, apply pressure on either side of the object and raise the area above the level of the casualty's heart. Secondly, is to minimize infection. Secure the dressing with a bandage that is firm enough to maintain pressure, but not so tight. If bleeding shows through the dressing, apply a second one on top of the first dressing. If blood seeps through the second dressing, remove both and apply a fresh one. Support the injured part with a sling or bandage. Check the circulation beyond the bandage every 10 minutes. If circulation is impaired, loosen the bandage and reapply again. Thirdly is to prevent and minimize the effect of shock. As shock is likely to develop, help the casualty to lie down on a rug or blanket if there is one, as this will protect him from the cold. Raise and support his legs so that they are above the level of the heart. Finally, is to arrange urgent removal to the hospital. You or ask a helper to call 999 for emergency help. Monitor and record the casualty's vital signs such as breathing, pulse, and level of responsiveness while waiting for help to arrive. Do not allow the casualty to eat or drink because an anesthetic may be needed. You may remove or cut away clothing to expose a wound if the clothing has contaminated the wound.
Nose bleeding occurs when there is a direct blow on the nasal area. Other causes of nose bleeding may include sometimes if we sneeze too forcefully or if we apply local trauma. Local trauma, for example, if we, because of obstruction, we insert finger or insert object to clear the obstruction. Those may cause bleeding from the nose. As for ear bleeding occurs when there is also a possible direct trauma or a blunt injury over the head near the ear area. Other causes include a blast injury, explosion, infection, or sometimes a perforation of the tympanic membrane or the eardrum may cause bleeding from the ear. However, when the person has ear bleeding and nasal bleeding or nose bleeding together, and some more the bleeding involve watery fluid, do suspect more serious condition such as bleeding from the brain or a brain intracranial bleeding. Treat the condition seriously and carefully.
For management of nose bleeding, the aim for nose bleeding is to maintain an open airway and control bleeding. First, tell the casualty to sit down and slightly tilt his head forward so that to allow the blood to drain from the nose. Advise him to breathe through his nose and to pinch the soft part of the nose for up to 10 minutes. Ask the person not to speak, swallow, cough, spit, or sniff, since this may disturb blood clots that have formed in the nose. Give him a clean cloth or tissue to mop up any dribbling. After 10 minutes, tell the casualty to release the pressure. If the bleeding has not stopped, advise him to reapply the pressure for 2 further periods of 10 minutes. Once the bleeding has stopped, the casualty still leaning forward, clean around his nose with lukewarm water. Advise him to rest quietly for a few hours and tell him to avoid exertion, in particularly not to blow his nose because this may disturb any blood clot formation. If the bleeding has stopped and then restarts, help the casualty to reapply pressure again. If the nosebleed is severe or longer than 30 minutes, arrange to send or take the casualty to the hospital. Do not allow the casualty to tip his head back, since the blood may then run down the throat and this may induce vomiting. A victim presenting with ear bleeding may have the following sign and symptom, such as having sharp pain over the affected ear. He may have deafness and possibly dizziness as well. Management of ear bleeding. The first thing will be you need to help the casualty into a half-sitting position. Tilt his head to the injured side so that this will allow the blood to drain freely from the affected ear. Advise him to hold a sterile dressing or a clean, non-fluffy pad lightly over the ear. Advise him not to plug the ear and arrange or send the casualty to the hospital. Along the way, reassure him and always treat for hypovolemic shock. If there is bleeding from the ear and the bleeding is containing of watery fluid, more so the casualty has deteriorating level of consciousness, suspect possible base of skull fracture, and send for immediate hospital.
We have come to the end of the topic. In summary, what we have learned so far, we have covered shock and we have covered bleeding. Our body contains of an extensive network of vessels that is from the pumping of the blood, and when the heart pumps, it will reach the vital organs. The heart, when pumping, will circulate oxygenated and nutrient in the blood to the vital organs. When there is a bleeding, it occurs when there is a break in the tissue, permitting the exit of blood from the vessels. Bleeding can be internal bleeding, can be external bleeding. What happens in external bleeding, it can be seen, whereas in internal bleeding, you cannot see because it is inside the body. When there is excessive loss of blood or bodily fluid, this will cause hypovolemic shock. Hypovolemic shock is the main cause of shock. When shock happens, the person will have symptoms and signs suggesting a shock. How do we treat for shock? Basically, we have to lay down the person, elevate the leg, and encourage blood flow reaching the vital organs. At the same time, try to find the source of the blood loss. For external bleeding, control the bleeding by applying direct pressure and elevate the affected part. Whereas for internal bleeding, very minimal can be done. You must arrange for urgent removal of the patient to the hospital. Always remember to assess the casualty's vital signs while stabilizing the casualty, while waiting for the ambulance to arrive, and also while on the way sending the casualty to the hospital. Apart from assessing, we also encourage you to reassess the vital signs at a regular basis. Normally, we encourage every 3 to 5 minutes reassessment. Examples of vital signs to assess include the conscious level of the casualty, the respiratory rate, the pulse rate, and if you are trained to take a blood pressure of the casualty, you also need to monitor the blood pressure of the casualty. Our next topic that we'll be covering will be on bone, muscles, and tissue injuries. It is still somehow related to shock and bleeding, for reason because for bone injuries such as a fracture, which is a break in the continuity of the bone, it may injure the surrounding tissues, causing bleeding. And when bleeding occurs excessively, it may also lead to shock.